Hey, you guys, it's Dr. Hodges, and I am just about to run out of the office for the weekend. And I was doing some Friday consults, and it got me thinking about some questions that have come up because I usually see my 1 week and 1 month follow ups. And I wanted to kind of go over very quickly maybe some misconceptions or things that you just don't think about in the immediate post-operative period that might be helpful. Number one, it is normal to have some regret after surgery. These are elective surgeries, but you know what? Surgery hurts. So some people are a little surprised that even though they have little incisions, they have big pain. And remember, everybody has a different threshold. I have some patients that will come in and they don't have any pain. They haven't used any of their medication. And then I have others that really struggle. It is not uncommon for patients to have musculoskeletal pain, meaning pain in their abdominal wall. You actually don't have a lot of pain from me cutting on the gut, but it's really from the abdominal wall being stretched, and then also where the larger incisions are from where I've had to dilate and put my stapling device in, or if you've had a sleeve or a duodenal switch where I've had to go in and remove stomach. That is where patients can have some soreness. Oh my gosh, I just have to digress. Look at this. I cannot stop staring at it while I'm talking. Look at that dead plant. OMG, I've got to get a fake plant because I just never water it. I'm just going to do this. I cannot stop looking at it. Sorry. Okay, so back. My husband says he's a psychologist, and he says if you're taking a Rorschach test, that's an ink blot, and all of a sudden you look up here, that's a D99. That's literally what he calls me. For a long time, that was my nickname, DD99. Okay, back to what we were talking about. It is not uncommon for patients to have pain. I've had some patients that they get very nervous that if they're having a lot of pain, can they sleep on their side? So for instance, let's say your largest incision is on the left and you're having more pain on the left. Am I going to hurt something if I sleep on my left side? The answer is absolutely not. Not going to have any injury. Sleep on your left side. It just might not be that comfortable. Another thing is some people really like to wear abdominal binders. You can wear an abdominal binder. You can wear a girdle. I also have some people that are like, I don't want anything touching me, and I want the loosest pair of drawstring pants that are out there. You can do either or, dealer's choice, okay? I think another thing is that, and this is really for my men, because you don't get pregnant, and for my women that have never really been pregnant, so like my young girls, when you have surgery, your sense of smell and sense of taste can be heightened, and it's almost like you could smell a gnat fart from a mile away. I don't know why that happens. I definitely think it has to do with fluctuations in your hormones because you're having fluctuations in your fat levels fairly quickly after surgery. So for instance, I operated on my mom, and it was 2 days before Christmas, and I remember cooking dinner. She was staying with me the week after she had her surgery, and I was cooking Christmas Eve dinner, and she was like, I need to go upstairs, I just can't smell this. Just know that that's normal. That's one of the reasons why I might tell patients that, when you're preparing for surgery, go and get some of your protein shakes, but don't go to Costco and go get 12 cases, because you may find that even if you tolerated a protein drink before surgery, for the first week or two afterwards, it may seem really, really sweet or really, really thick. And if that's the case, dilute it with a little bit of Fairlife milk. So I think sense of taste, sense of smell, how you're perceiving pain. Make sure if you take any medicines for depression or anxiety, absolutely make sure you get back on those. Stick with your post-op diet. The most important thing that patients can do after surgery, and certainly within the first 24 hours of surgery, make sure you're staying on top of your pain medicine. If you can take your pain medicine every 6 hours, whether you're in pain or not, set an alarm, take your medicine. And if that means that you have to wake up at midnight or 1 a.m. to take your pain medicine, I recommend set your alarm, wake up, take your medicine, because what you don't want to do is wake up in the morning And now all of your pain medicine is now completely metabolized out of your system. So I've had surgery before, and I can tell you that happened to me, and I was like, oh my God, and it was really painful. So stay on top of your pain medicine, stay on top of your liquids, sip, sip, sip on your liquids all the time. Make sure you're walking to and from the bathroom or to and from the kitchen is not what I mean by walking, because typically when you're in the hospital, we have you walking up and down the hallways in front of the nurse's station. You need to be at least doing that, if not more. These are laparoscopic cases. These are not open cases. They're laparoscopic, low downtime. You got to go. You got to start walking. You got to move. If you do not move, you will have more back pain. You can have pain between your shoulders, and it's just because you're not moving a lot. Okay, so these are a couple of things that patients just might not think about. If you're getting a little dehydrated, your lips might be a little dry, slap on your Laneige or your e.l.f. dupe. That's going to help with some lubrication in your lips. Make sure you take showers every day. Don't soak in a bathtub or hot tub where you're really soaking those incisions, but make sure that you're taking your bandages off. Soap water, pat them dry, put bandages back on. So make sure that you're keeping up with that. Sometimes people can get, if you're a little dehydrated, or if you're just drinking like the same sweet protein drink, you might get a bad taste in your mouth. Brush your teeth every day. If you notice that you're brushing your teeth and you're like, I look like I have this film or fur in my mouth. At the time of your surgery, we give our patients a big antibiotic. You could have thrush just from us killing the good bacteria along with the bad. If that's the case, call your doctor. So if you have a really thick film, you just may need some like an antifungal swish and spit, and it's just that, you know, but you might need some medication because you might have a little oral thrush. Okay, so these are some of the little tips and tricks. You're going to be seen by your surgeon. You'll be seen by me within a week or two after surgery. We'll get your sutures and staples out, and we'll see how you're doing. But I will tell you this. When you undergo bariatric surgery, it is hands down the very best thing that you can do. We're going to get you healthy. We're going to get you feeling better. But there can be a little bit of hump because, again, it is just surgery. You know, when I got done with medical school, you have like a month. Med school gets over in May. Residency starts June 1. And I went to Africa. I went to Nigeria, and I operated for a couple of weeks with Dr. Kamazine, Earthwide Surgical. Look it up. Donate if you can. He's been going there for, I don't know, 20, 30 years. It was the most amazing experience. I fell in love with general surgery all over again because I initially thought I wanted to be a plastic surgeon. And I now realized God had different plans, clearly. I would have been a terrible plastic surgeon because patients come in and they ask me about loose skin and I'm like, honey, I think you're beautiful. I would have been broke. I would have been a terrible plastic surgeon because I'm like, So, but anyway, when I went to Nigeria, it was all it was like old school hospital ward systems. So all the men recovered and there was no private room. It was like one big room with all these hospital beds and all the women, all these hospital beds. And oh my goodness, like the men, they would go in for a groin hernia. They'd be there overnight. I'm like, here in the States, it's not that way. And I remember Dr. Kamazine telling me, he's like, Charlotte, you just need to go. You got to get them all discharged. So I remember walking in and they called me Sister Doctor. And I walked in and there must have been 20 men in the men's ward. And I said, good morning. And they said, good morning, Sister Doctor. And I said, good morning, gentlemen. Surgery hurts. You're all going home today. So that is what I'm telling you guys. Sister Doctor says, surgery hurts. You got to get it together. It is going to be okay. You're going to get over this hump. It's completely normal for you to wonder, did I make the right decision? And I'm telling you right now, emphatically, it is the best decision you've ever made. So I promise you, we will get you through this together.